everyone and welcome to my channel. So we have started the pediatric subject and we have discussed some units, and now we have started the CVS. In CVS we have discussed the tetralogy of Fallot. Now we are going to start this topic, that is transposition of great arteries. Now we are having a scenario that there is a 1 month old infant admitted with history of respiratory distress and central cyanosis. Parents say that he has cyanosis since birth but developed respiratory distress recently. His echocardiography report shows that he has TGA. So, what is the TGA? What is abnormality in it? Complications of cyanotic heart diseases, names of cyanotic congenital heart diseases, and the treatment of transposition of great arteries. Okay, we are having this scenario. We will discuss another scenario. Okay, what are the cyanotic diseases and what are the acyanotic heart diseases? Let's discuss it first. The cyanotic heart diseases are tetralogy of Fallot, transposition of greater arteries, tricuspid or pulmonary atresia, and truncus arteriosus. While the acyanotic heart diseases are ventricular septal defect, patent ductus arteriosus, arterial septal defect, pulmonary or aortic stenosis, and coarctation of aorta. So we have 4 main cyanotic heart disease and 4 main acyanotic heart diseases. Now coming towards the transposition of greater arteries, which is our main topic, that this is the most serious cyanotic lesions seen in the newborn period, 5%, and they rarely survive. Okay, the transposition of great arteries is a disease of the cardiovascular system which is by birth, and later it reappears with the respiratory distress. So this is the most serious cyanotic lesion seen in newborn period. Aorta arises from the right ventricle and pulmonary artery arises from the left ventricle. Then associated abnormalities may include VSD, PDA, pulmonary stenosis, or combination of these. TGA is more common in infants of diabetic mother and in males. The abnormality or pathophysiology in the transposition of greater arteries. We have discussed that this is the most serious cyanotic lesions, and it is associated with associated abnormalities may include VSD, PDA, and pulmonary stenosis. Now, what is the pathophysiology? It is desaturated blood reaching from the body to the right side of the heart passes through aorta and back to the systemic circulation again. There is abnormality in which the desaturated blood reaching from the body to the right side of the heart passes through aorta and back to systemic circulation again. Oxygenated pulmonary venous blood returning to the left side of the heart is returned directly to the lungs through pulmonary artery. Thus, systemic and pulmonary circulation consist of 2 parallel circuits. Only means of survival in these newborn is mining of oxygenated and deoxygenated blood by persistent of platelet foramen ovale ductus arteriosus or VSD. Okay, so this is the pathophysiology. What happens? That the systemic and pulmonary circulation consist of 2 parallel circuits. Now the investigation options for TGA is chest X-ray, ECG, echocardiogram, and arterial blood cases. The medical management for TGA is prostaglandin E1 infusion is started immediately in a dose of 0.5 to 0.20 to maintain the patency of ductus arteriosus. Hypothermia should be corrected as it amplifies the metabolic acidosis from hypoxemia. Prompt correction of the acidosis and hypoglycemia is essential. In infants with heart failure, the usual anticongestive measures including digoxin, diuretics, increased caloric density of the formula, and after-road reduction are helpful. Okay, so what is done basically? There is having a two parallel circuits are present, so we have to decrease the load. So for that the medications are used, and these are the prostaglandin PGE1 infusion, and also the hypothermia is corrected, and after load reduction is done. Now the surgical management are: all patients with favorable anatomic and hemodynamic criteria should be offered corrective surgery by age of 2 weeks. Okay, corrective surgery is done. Okay, Reichkind procedure or balloon atrial septostomy is initial palliation formation by rupturing arterial septal through fossa and ovalis with balloon catheter. This method is used to treat the TGA. That is, all the patients with favorable anatomic and hemodynamic criteria should be offered corrective surgery by age of 2 weeks, and Reichkind procedure or balloon arterial septostomy is initial palliation. Now, mustard procedure also involves insertion of an atrial baffle which okay, pulmonary venous blood to the aorta and pulmonary artery. Total repair by arterial switch technique having TGA with intact ventricular septum is done. So these are the treatment options. We have discussed the TGA, then we have discussed the definition of the TGA, then what is the pathophysiology of the TGA, what are the cyanotic heart disease and what are the acyanotic heart disease. Then we have discussed abnormality or pathophysiology of the TGA. Then we have discussed the different investigation options. Then we have discussed the medical management. And we have discussed the surgical procedures in which there is Reichkind procedure or balloon arterial septostomy, and mustard procedure involves insertion of an intraatrial baffle, and total repair by arterial switch technique having TGA with intact ventricular septum. So these are the specific treatment measurements for the TGA. So what is TGA? It is a it is a disorder which occurs by birth, and it is cardiovascular disorder, and the patient represent with respiratory distress and central cyanosis. So these are the diagnostic points of TGA. In the next video we will discuss ventricular septal defects. Thank you.